The philosopher Plato once said, reality is created by our minds. So therefore, if we can change our minds, then we can also change our reality. And this idea has been brought forth in many, many different ways, and certainly in today's types of psychotherapies like cognitive behavioral therapy, where our belief systems, the way that we navigate through the world, the way that we think about ourselves, other people, the world, and the future, these belief systems can really positively or negatively impact our mental health. I'm a psychologist, and today I'm going to talk about 6 mindsets that are going to be beneficial for your mental health, and you can even start to adopt some of the general principles today. So, the first mindset that's beneficial to mental health is the I'm willing to give it a try mindset. So, oftentimes when we're very anxious or we're in a depressed mood, our brain tends to make predictions about the consequences about doing something. Like, even if I do go for that walk, I'm not going to feel any better, or if I talk to that person, they're going to reject me or they won't like me. So, our mind constantly makes these predictions that are generally negative in nature, especially when we're dealing with poor mental health. And as a result, we get sort of stuck in this vicious cycle because we stop doing the things that we enjoy and we stop engaging with the world, which is what anxiety tells us to do, to avoid and limit your world so that you stay safe. So one way to escape this sort of anxiety or depression trap is to actually take a more flexible, curious framework to say, well, I actually don't know what would happen. My mind made a prediction, but I have no idea what will happen in reality. So why don't I just give that walk a try? Why don't I spend some time talking to that person, see if I would actually feel worse, or if that person really doesn't like me? At least that allows me to open up my world and engage in activities that might give me a little bit of joy, a little bit of pleasure and mastery and meaning, and be able to open up and expand my world again. And being willing to give something a try doesn't mean it's always going to work out, but certainly it gives us a better chance of escaping this pattern than not doing anything at all and following what our brain's negative prediction says, because that's definitely going to keep us stuck. So this sort of more flexible framework simply gives us a chance, a better chance, to actually reach our goals and reduce our sort of negative, poor mental state. A second mindset that I think is beneficial for mental health is the serenity prayer mindset, which, if you know the serenity prayer, it basically goes like, grant me the courage to change the things that I can control, the sort of willingness to accept the things I can't, and the wisdom to know the difference between the two. And why this is important is because the world fundamentally is not black and white. You can't change everything in life, and neither should you accept everything in life, especially things that you feel like you can problem solve and control, because both of these pathways lead to an ineffective way of truly navigating effectively throughout life. So it's important to be able to identify in your life what are things that you can control, what are things that you should accept, and be able to, again, use the wisdom to identify the difference. Like, for example, someone with chronic pain may have to accept that the chronic pain is a part of their life forever, and in sort of the areas that they can control, still do the things to manage the pain as good as possible, as well as be able to, continue to engage in things that are important in their life, like social relationships or hobbies or other valued activities. A third mindset that's beneficial for mental health is the effective mindset. And the idea of effective mindset comes from the term effectiveness in dialectical behavior therapy, where essentially the idea behind effectiveness is that, are my behaviors, my set of behaviors right now, consistent towards the goal, towards the outcome that I'm looking for? Like, for example, if I'm just really interested in being right in this moment, then maybe the most effective way is to yell and shout my point and try and prove the other person wrong. But maybe I'm talking to my partner and that's not really my goal in that moment. It's really to understand. It's really to, come towards a mutually agreeable conclusion. In that case, the same behavior of yelling and stating my points and trying to reject theirs isn't going to be particularly effective in that situation. So in order for you to understand what behaviors are going to be most helpful, you need to first identify what is your goal and then work backwards. Are my behaviors in this moment actually more or less likely to get me towards that goal? And the reason why I think the effective mindset can be so helpful sometimes is that there are sometimes barriers that make it hard for us to engage in the effective behavior. Like, for example, we might think, oh, it shouldn't be like this. It's not my fault. It's not my responsibility. Or I'm not really deserving. I don't feel like I'm worth it to do these things for myself. And the effective mindset allows us to almost bypass these judgments of self-esteem and, whether things should be a certain way. And it really just says, hey, like, this is the outcome you're looking for. What are the behaviors that are most likely to get you closer to that goal? So, a fourth mindset that's helpful and beneficial for mental health is the thoughts or just thoughts mindset. So, oftentimes when we have scary thoughts or thoughts like, I'm stupid or I'm boring, we tend to really believe those thoughts. Like, we create a lot of emotional salience towards them. We feel bad. We think because we feel like we're a failure, we are a failure. So, as a result, we almost assume that these thoughts are facts. And in reality, thoughts are not facts, they are just thoughts. And the more that we're able to say, hey, like, I just had a judgment or I just had a worry, but that doesn't really mean that this worry is going to be true or that this judgment is true. The less power these thoughts have over us and the more control we have about the types of thoughts that we have and how much we want them to actually emotionally impact us. And some ways to increase that psychological distance, make these thoughts feel a little bit less powerful, is one, just by labeling them, saying, oh, like I'm noticing I have a lot of worries right now, or I'm noticing that I have a judgment about myself right now, or being able to almost treat these thoughts like visualize them as like clouds in the sky that are kind of just floating away so that they don't really kind of feel as fused to our experience. Those are just a couple possibilities to kind of reduce that distance, the power that these thoughts have over your well-being. And then the fifth mindset is the it's okay to not always feel good mindset. So oftentimes when we have sort of negative experiences, we're like, oh, this is so painful. I hate it. I don't want to feel this way. And in some ways, what we resist tends to persist. So being able to sometimes allow yourself to experience disappointment, to process grief, to almost be in the feels, that can be a great way for your body and your mind to really sit with and notice these feelings and allow them to be processed so that you don't have to consistently be in that moment. And another thing about sort of this idea is that sometimes we have a very reactive experience to these negative feelings. And again, as we kind of talked about, pain is kind of like a mandatory experience, but suffering is optional. And the more that we resist, again, these uncomfortable feelings, they really just become more and more powerful. So the more we can just say, yeah, you know what, like right now, it is a hard time. The more we can accept these painful experiences, the less power they will have over you. And the sixth mindset that I find beneficial for mental health is the process mindset. So we as human beings tend to be very outcome driven. We're really more focused on the grades, the salary, the outcome, whether we win, and just celebrating the achievements of climbing the mountain. But sometimes the outcome is kind of out of our control. Like, even if we make our best application, we may not be the person to get the job or get into graduate school. And putting everything, our eggs in one basket on the outcome, sometimes can lead to vulnerability in our mental health. So, although the outcome can be very important, it can be really helpful to also put some value in the process, the climbing of the mountain, if you will, where you're able to say, hey, like, yeah, it'd be great to be able to get the job, but maybe I can put some more self-worth in just the fact that I made an application. Or, even if I'm not the best French speaker in the world, I can still say, hey, like, maybe I can get some self-worth just by virtue of like continually being that person to study some French every day. So by making the process a bigger piece of the pie, those become things that we are more able to control, because we can always control, how much we study for something, but we may not always be able to control the grade that we get. So focusing a bit more on process can be really helpful in that regard. So of course, you don't have to take all of these different mindsets into your life. Maybe there was one or two that kind of resonated with you to practice in principle a little bit more. And if so, that'd be super helpful for you to experiment with it, see how this new framework fits with you and your overall mental health. But otherwise, thanks for watching, and I'll see you in the next one. Bye-bye.